Hi there. Thank you so much for taking the time to join me on this Monday Moments. On today's episode, we're going to be talking about the 4 things that are currently happening that may be falling through the cracks in your emergency department. Number 1, patient callbacks. We know that it's extremely important for the patient to have continuity of care. Previously, before, clinical staff were the ones that were making the callbacks to patient, informing them of their test results and if they needed to come in. Who's doing that now in your facility? Don't let that fall through the cracks because it's extremely important for patients to have that quality of care, and that should not be compromised. One solution is doing an outsource model, or another solution is shifting that model to nurses. Nurses can be trained in knowing how to do prescription calls, callbacks, and exactly protocols they need to follow. And this is an extremely easy way to shift this model. However, appropriate administrative time and training is required for this. Number 2, telemedicine. Now more than ever, we know that telemedicine is being normalized as a way of access to care for patients. In so many circumstances in the ED, we know that telemedicine can be used rather than coming in. And this is a great way for reimbursement to occur as well as continuity of care for the patient. So make sure that you have telemedicine as a way for the provider to connect and follow up with patients in the ED or urgent care settings. Number 3, triaging. So we know that triaging has completely changed with COVID. How have you updated and revised your protocols? This is extremely important to take into account, especially in the waiting rooms of EDs and urgent cares. Waiting the same way as we used to do before is just not sufficient. So have you revised your protocols? If not, definitely connect with us and we can help you with that. And number 4, inventory of our values. Don't let this fall through the cracks. And as simple as this sounds, this is an extremely important time to really take inventory of our values as an organization and take a moment to realize, are we perpetuating and are we reinforcing values that align with the mission, vision, and core values of your company? So much has been at stake and so many things have had to be cut because of budgets, but that doesn't mean that core values have to be compromised. What message are you giving to your employees, clinical staff, when values are not being reinforced? This is extremely important to take time to just step back and inventory that. Don't forget that as a part of things falling through the cracks.